Go here, Agus Ara, and I suppose, Minister, as we get to the end of the mental health bill, I just want to commend all of your own officials who have worked on this, all of the stakeholders who have engaged with you on it, and to you yourself. I know you've engaged with many of us across the House, and particularly some of your government colleagues who had concerns in relation to it. I want to speak to this group of amendments, Minister, because obviously it deals with the issue of involuntarily adult admissions. And I suppose in many ways depriving anybody of their liberty is an incredibly serious thing, and so it should be difficult in order to secure an involuntary adult admission. I suppose trying to find that line of it being difficult and too difficult has been the job that you've had to do. I suppose where I had some concerns at earlier phases of the bill was in relation to dual diagnosis, and I want to be careful using that term because when I use it, I'm relating to dual diagnosis of addiction and mental health. But of course, as has become very obvious from the conversations in the Shannon with colleagues there, a dual diagnosis can mean many things, and it can relate to dual diagnosis, for example, of autism and mental health, or many other conditions. So specifically in relation to dual diagnosis for addiction and mental illness, Minister, you'll know, because I've plagued you about it many times, the report, Dual Diagnosis, a Community Inquiry, which was carried out by Dublin City University and the Finglas Addiction Support Team, specifically referenced areas in relation to dual diagnosis for addiction and mental health which need improvement. And I have to say there have been significant improvements since that report was published in 2020, namely around the National Clinical Programme. The report did reference areas of the mental health bill where I suppose the idea of a wrong door was being experienced by people, and so in some cases people weren't able to access a psychiatric facility because they may be using either an illegal substance or a legal substance, and at that very moment where they were in crisis or where they were seeking to deal with their addiction, they found that both services, the addiction services and the mental health services, often were citing their other diagnosis as a barrier to them entering. And as one person in the report said, I just think when you have somebody, when you get somebody into a service and there's an opportunity to make good progress, it shouldn't be missed. And I think that idea of catching somebody as they're falling, Minister, is really, really important. Look, I watched very closely the debate in the Shannon on this, Minister. I think you were very strong in outlining why in primary legislation the phrase dual diagnosis couldn't appear. I suppose what I would be anxious for you to do is to repeat here in the Dáil the commitments that you gave in the House in regards to a dual diagnosis protocol, and if you could outline to the House how that might work, or you can write to me on it. But I suppose what I want to do is to record what has happened in the other House, in this House, and what I want to record is the attempts that were made to make changes to the mental health bill and the reasons why that didn't happen. And then thirdly, that while things might not be able to be dealt with in primary legislation, that doesn't mean that we can't deal with them overall. And I would say that regardless of what happens with the mental health bill, that I would ask you to continue to be committed to the issue of dual diagnosis for addiction and mental health.
In relation to, I find my note now, I have so many of them. In relation to dual diagnosis, the very first meeting that we ever had back in 2020, you were a new TD, and the very first meeting we ever had was in relation to dual diagnosis. And I do want to thank you for raising this issue. I know you're passionate about improving the service for people with coexisting mental illness and substance abuse disorder, and you have done a lot of work in your own right. I want to state unequivocally that people with coexisting mental disorders and substance misuse disorders can and do access inpatient and community mental health services. This wasn't always the case. You know, I always have an awful lot of people still have a huge affection to a vision for change, but a vision for change did not allow for a dual diagnosis, but sharing the vision did, and that's my Bible, and that's the Bible I work off since June 2020, and that was really, really important because there were doors being slammed into people's faces. because, you know, they might have a mental health disorder, but they were also had substance abuse, and it could have been alcohol, it could have been drugs. And it is really, really important that that's recognised. It won't be included in primary legislation. It will be included in secondary legislation. And I have asked the HSE to develop a protocol in relation to access to services for people presenting with dual diagnosis of a coexisting mental disorder or difficulty and a substance use disorder. I believe that a dual diagnosis protocol can address many of the issues around access raised by senators, by yourself, by other deputies, and provide clarity to services working across mental health and substance misuse on access and providing treatment. I think, you know, my position is that the solution to this issue is to continue to fund both general mental health services and specialised dual diagnosis mental health services to improve access for all. I'm not going to stand here and say there's not an issue. There are issues in relation to people with dual diagnosis, and doors are slammed. And that's why we're working really, really hard to change that. I launched the Dual Diagnosis National Clinical Programme in the new model of care in May 2023, and we're now investing over €5 million annually from the mental health budget, matched by social inclusion, to develop specialist community teams to support people with mental illness and substance abuse issues. The primary purpose of the Mental Health Bill is to set out the legal basis for the involuntary admission of people to acute mental health settings. The bill cannot and does not provide specific medical pathways or legal safeguards for access to services for any specific cohort of person outside of those who are subject to involuntary admission. And more especially, it does not provide for admission and access to services for any person, either in the community or inpatient, who does have a mental disorder that does not meet the criteria for involuntary admission. Importantly, the bill does not discriminate about what mental disorder a person has. So it doesn't specify in the bill, but it doesn't need to specify. And how we deliver our services will come in secondary legislation. And like, I'm very looking forward. We actually had a meeting in relation to it yesterday. With Ian, my advisor, in relation to the Keltai facility and the day services that will be provided there, and we are making progress. Again, the funding is there, the staff are being recruited, and we want to get that open as quickly as possible. I hope I've answered everything.